In today's Eye on Health, news of the coronavirus is really overshadowing other health news lately, but there is an ongoing issue that cannot be ignored, and it's possible that it's being made even worse by COVID-19. Talking about opioid addiction. With the spread of coronavirus leading to financial challenges and social isolation and some changes to in-person medical care, people dealing with addiction could be facing new challenges. But our next guest says, thankfully, there are ways to get around the obstacles. Welcome Dr. Caesar Deleo, Vice President and Executive Medical Director of Strategic Initiatives for Highmark Health. Thank you for joining us, Doctor.
Good morning, David.
Well, first off, I want to ask about why there could be an increase in addiction issues right now, because it's not just our area. I've seen reports of this all across the nation, and there are some real reasons that COVID sort of caused, right?
Well, the stay-at-home orders have created social isolation, and social isolation for someone who is in recovery or contemplating treatment is really poison. So it's created its own problem.
And you guys are really using technology to try to get past that isolation, right? What are you doing?
Well, connection and peer support are crucial components of treatment and long-term recovery. COVID is, as you inferred, really threw us a curveball. But this year we launched a technology-enabled program that has been effective in addressing some of the challenges of the stay-at-home orders. So through this program, Highmark engages our members, our patients, through either a computer, a tablet, or a smartphone. Members are connected to multidisciplinary clinical teams made up of counselors, physicians who can prescribe medication-assisted treatment, which can help suppress cravings and also help with severe withdrawal symptoms. Our one partner in this is the Allegheny Health Network, the Addiction Medicine Department, who is now doing the majority of their treatment cases via tele-addiction services. And they have seen an increase in the volume that they have been managing. But also we are excited about a company called Bright Heart Health, which is a clinical company which is nationally recognized and provides addiction tele-treatment services 24 hours a day, 7 days a week. We know that it works because of their collaboration with Stanford and the studies that they've been doing to prove that this is effective. We know that 90% of their patients remain engaged in the program at 90 days, and 90% of their patients are also free of opioids at 90 days. And the healthcare cost savings are significant. The estimates vary, but depending on the published report, they can go as high as $20,000 per year. So connection is crucial in recovery. And during the pandemic, technology is helping us to accomplish this goal.
And it's not just technology. You were talking about how your employees want to step up and be able to do whatever they can do to reach out to these people, right?
Yes. So over the past few years, myself and my colleague Ashley Potts have spoken in front of numerous audiences, and we are always impressed because afterwards people come up to us and relate just how personal this is to them. And they want to know, how can they get involved? How can I help is the question. So we put together what we call the Learn program, and the Learn program currently has almost 600 Highmark employees and Allegheny Health Network employees who are involved. And LEARN is really an acronym, and it stands for learn about substance use disorder, educate others eventually, advocate for effective treatment and support, promote recovery, and also network amongst themselves, their communities, their organizations that they belong to dispel stigma and promote harm reduction in the community. The program meets monthly. It's really exciting. We have a lineup of speakers who include clinicians, they include patients in recovery, harm reduction specialists from across our 3-state network, and our program continues to evolve. And one of the beautiful things is a lot of it is really self-guided. So it is up to the individuals who can influence what topics that we address and where we go with this program.
Such an important topic. Thank you, Doctor, for talking with us today about all of it.
Thank you, David.
All right, take care. Dr. Caesar Deleo, we appreciate your time. And remember to keep watching our Eye on Health series here on PTL. It happens on Wednesdays, and it's brought to you by Highmark Blue Cross Blue Shield, together with Allegheny Health Network for your health.